first of all, I would like to ask for your permission to use this video for educational purpose.
Sure.
You do not look like somebody who had a 3-level fusion, 8 screws, 2 rods, 3 spacers just yesterday, less than 24 hours ago. How do you feel?
I feel good.
So tell me about the pain level. How bad is the pain right now?
Pain right now is about a 3 or 4.
Okay. Now you told me about actually about another of your neighbors who had
a lady lives across the street from me, and she had a similar surgery.
But open.
But open. And she showed me her scars, and there was about a 6-inch cut on each side of her
vertebra.
Yeah, her vertebrae.
Mm-hmm.
And she had a lot of pain afterwards with it too.
Mm-hmm.
But I don't know if she had any complications. She didn't say, but
Mm-hmm.
yeah, when I saw that, I was researching and I was looking through the internet to find, spine doctors.
Mm-hmm.
And she gave me her doctor's name, which I wrote it down, but I didn't do anything with it.
Mm-hmm.
I looked into Rochester, and the thing I don't like about Rochester, I've had 2 surgeries there, and they use a team approach.
Mm-hmm.
And so I had a hernia operation, right side, and the top guy in the group, he set up the surgery and everything, but he didn't do the surgery. His number 2 guy did it.
Yeah.
And the number 2 guy did the whole works after that, the follow-up and everything, and I never saw him again.
Yeah.
So I wrote him down, and then my niece recommended a doctor that does it for the Minnesota Vikings.
Oh, okay.
And I looked into his background and his training and stuff, and then I found Inspired Spine, and I found you in the cities, and I looked at your background and your training that you had done over in Germany and in the U.S., and the fact that you've written many things, and also you teach other doctors how to do the procedure.
Yeah.
And with an invasive surgery, you told me that there's less chance of pain and hitting nerves and stuff like that.
Yeah, with minimal invasive.
That convinced me, that you were the right guy for the job.
Well, so far, it's just the day after the surgery. Have we delivered so far? Your expectations?
Yes,
Yeah,
definitely.
so no, you got one of the biggest surgery anybody can get, a 3-level fusion.
Yeah.
And I was just looking at the surgery was done less than in 70 minutes actually. The exact time was 67 minutes.
That's amazing.
And we put the 4, on each side 4 screws, so total of 8 screws, 3 spacers, 2 rods. And surgery was just yesterday afternoon. And, most of our patients go home actually one day after the surgery. Obviously, it still will be difficult. Certain things, bending, twisting, lifting will be difficult.
Sure.
But after have seen thousands of spine surgeries, you do not look like somebody who had a 3-level spine surgery yesterday.
Yeah, I feel really good today.
Excellent. Well, and this is the point, that we don't cause too much damage on the way of getting it. Before the surgery, how long did you have back pain before the surgery?
How long?
Yeah, how many years?
Well, I had back pain for several years, but it was in the upper back, and a chiropractor fixed that. Then I went to the lower back, and he fixed that. Then what happened was arthritis got in there. He couldn't adjust it anymore. And so for the last year and a half, I've been in pain with it. Had cortisone shots, had physical therapy, everything, and nothing worked.
And you have a scoliosis as well. If you remember, we looked at it together. Your spine, your vertebrae, your disc, they were collapsing unequally on each side to the point that your spine was side bending significantly. And the bone was literally grinding the bone. All of that is taken care of.
And I'm retired, and my one pleasure in life is golfing. I golf almost every day, and last fall I could not. In October, I could not golf anymore.
That makes me really happy that one day after the surgery, you're thinking about your hobby, your golfing.
I am.
Because people after this kind of surgery, one day later, they have other issues. They don't think about golfing.
I even tried to go out this year, or actually a few weeks ago, just to putt and chip. And when you putt and chip, you just bend your back slightly. and I could only stand it for about 10 minutes, and then the pain was there. So I knew I couldn't even golf one hole.
So it was time for you to get that fixed.
Absolutely, yeah.
So now, overall, I think, the surgery went well. I will do the paperwork. It's a good chance you'll go home today.
Good.
But do you feel like going home?
Yeah, I feel okay. Yeah.
Okay, good, good. Well, thank you so much. I'll talk to you again when you come back to the office, okay?
Yeah. Okay.
Thank you so much.